Falls in the home or hospital are a serious health concern for the elderly population age 65 and older in the United States. The Center for Disease Control and Prevention, also known as the CDC, reports that 1 in 3 elderly adults experience a fall each year, and they estimate that half of the non-deadly falls are never even reported to a doctor or healthcare provider. Falls among the elderly can result in several negative health outcomes, such as broken bones, head injuries, and cuts and bruises, which can all lead to even further health complications. In 2013, the CDC had 2.5 million non-deadly falls reported by hospital emergency departments. In 2012, the direct medical costs of non-deadly falls was estimated to be $30 billion, and in 2011, there were sadly 22,900 deaths from falls among the elderly in the United States. Fortunately, falls are a highly preventable health issue. Since falls are the leading cause of death and injury among the elderly population in the United States, it is important that both individuals and healthcare providers learn about appropriate and safe actions to help decrease the risk of falls. This presentation will explain simple tips and changes that you can make in your life and in your home in order to remain healthy, live independently, and remain safe from falls. In your home, keep pathways clear by keeping loose objects off the floor, such as animal or children's toys and extra shoes. If you have loose wires laying on the floors, such as telephone or lamp cords, move them away from walking paths by coiling and tying them with twist ties or securing them to the walls with tape or tacks. Arrange your furniture so that there is a wide path for walking. If you use a cane, walker, or wheelchair, remove extra tables and chairs in order to make plenty of space to safely move around the rooms in your home. And try to avoid using furniture that has wheels, since they may easily slide out from under you. If you use a wheelchair, make sure to lock the wheels in place before attempting to stand up. Make sure all the rooms in your home and pathways, inside and outside the house, are well lit to decrease your risk of falling. Inside the home, be sure to have easy access to lamps or light switches at all entrances to the rooms so that you do not have to cross through them in the dark. At night, use night lights in hallways, bedrooms, and bathrooms to maintain even lighting and help you see your way to light switches or lamps. It is also a good idea to keep flashlights close at hand in case of power outages. Place these on your nightstand, next to your kitchen sink, and on your bathroom counter. Flashlights that plug into your electrical outlets are also available and can serve as both a flashlight and a nightlight in easy-to-reach places. And remember to test them on a regular basis to be sure they are working properly and to check if the batteries need to be changed. Tripping on area rugs, throw rugs, and doormats is a common cause of falls. Rugs and mats can also get caught on the bottoms of canes, walkers, and wheelchairs. One option to prevent this type of fall is to remove all extra rugs from your home. But if you would like to keep rugs and mats around, it is a good idea to secure them down with double-sided tape. Be sure to apply the tape firmly to all edges of the rug or mat and apply it firmly to the floor. In rooms where rugs or mats can get wet, such as the kitchen, bathroom, or front porch, it is better to use rug grippers or non-slip rubber backing, since tape loses its stickiness when wet. Make sure all stairs in your home are even and stable with sturdy handrails. The CDC recommends having handrails on both sides of all stairways for added safety. Be sure that all stairways have good lighting, during the day and during the nights. Use night lights to find the stairway and have easy access to the light switches at both the top and bottom of the stairs. Never use stairs without turning on the overhead lighting. If you have difficulty walking or use a cane, walker, or wheelchair, another good idea is to install low ramps on your front and back porches. And just like with stairways, all ramps should be well lit, even, stable, and have sturdy handrails on both sides. When working in the kitchen, keep things you use often in easy-to-reach places. Try to keep things at waist level and on the lower shelves. This helps to avoid climbing and stretching to reach for high-placed items, which can cause you to lose your balance and increases your risk of falling. When you do need to reach for items stored in higher places, use a step stool that has a bar to hold onto for support. Make sure that the step stool is sturdy and not placed on a mat or rug that may cause it to wobble. And remember one very important tip: never use a chair as a step stool. Chairs do not have rubber grips on the bottom, so they may wobble or slide, and they are too high to step onto. You can easily lose your balance and fall if trying to use a chair as a step stool. The bathroom is a common location of falls due to the combination of water and slick flooring materials like tile and vinyl. For this reason, installing several grab bars around your bathroom is a wise idea. Bars should be in the shower or tub, directly outside of the shower or tub, and next to the toilet. Place non-slip rubber mats on the floor of your shower or tub and right outside of it as well, to help avoid slipping when you are getting out of the bath. Using an elevated toilet seat with sturdy handles helps to keep you steady when using the toilet, especially if you are transferring from a walker or wheelchair. If you find yourself getting tired while taking showers, install a handheld shower head and sit on a sturdy shower chair. Keep in mind that shower chairs should be appropriately fitted for your tub or shower by an occupational therapist. Talk to your doctor to find out more information about this. In the bedroom, good lighting is a must to avoid trips and falls. Keep bright lamps on your bedside tables within arm's reach. In case of an emergency, it is also a good idea to have a phone next to your bed. Consider using a simple, inexpensive landline phone, which will work even during power outages. And don't forget your flashlight. Keep one next to the bed in an easy-to-reach location so that you can find it if the lights are out during a power outage. Some additional things you can do to keep your home fall-proof include placing phones near the floor in case you fall and are unable to get up. Wearing sturdy shoes and slippers that are not loose on your feet, both inside and outside your home. Be sure that all footwear have good rubber soles and are non-slippery. If you have pets in your home, be aware of their presence in the room. They tend to like to stay close and underfoot, so it can be easy to trip over them. This is a good tip for when you have small children visiting as well. Side effects and interactions between medications are a common cause of falls. Have your doctor or pharmacist review the list of medications you are taking currently and anytime you receive a new prescription. Many medications have common side effects such as dizziness or sleepiness, which increases your risk of falling. And the more medications you take, the more side effects you may experience and your risk of falling increases. Remember to always get up slowly after you have been sitting or lying down to avoid dizziness and getting lightheaded. Always take medications as prescribed by your doctor. And don't be afraid to ask your doctor or pharmacist questions if you do not understand how or when you should take a medication. Changes in your vision can increase your risk of falling. Have your eyesight checked by an eye doctor yearly and at any time that you feel your vision may be changing. Exercising regularly helps to improve coordination and balance and strengthen your muscles. Regular exercise can lower your chances of falling. Appropriate types of exercise that have been shown to help reduce falls include Tai Chi, strengthening exercises, balance training, and chair aerobics. Here are some additional local and national sources of information to assist you in your goal of remaining fall-free, healthy, and independent.